Good morning, students. Today we are going to discuss about the lecture number 34, and the topic is inflammatory bowel disease. And this topic, inflammatory bowel disease, sometimes get confused with a term that is called as irritable bowel syndrome, that is IBS, irritable bowel syndrome, and inflammatory bowel disease is IBD. So sometimes this gets confused between IBS and IBD. So this is not the same thing. IBS is actually the irritable bowel syndrome, which consists of a group of symptoms like abdominal pain, recurrent abdominal pain, abnormal bowel motility, constipation, or diarrhea. So these are the functional disorders. So this condition represents irritable bowel syndrome, IBS. And what is inflammatory bowel disease? In inflammatory bowel disease, along with these IBS symptoms, if there is inflammation, if there is ulcer, and if other damage, so that IBS symptoms along with inflammation, ulcer, and damage is called as inflammatory bowel disease. So mainly we have to discuss about inflammatory bowel disease. So actually it is a group of inflammatory condition of colon and small intestine, and it is defined as a chronic inflammatory condition of colon and small intestine, and which occurs due to inappropriate and persistent activation of mucosal immune system. So inside guts we have immune system, and if it is going to activate inappropriately, and it is due to the presence of normal intestinal flora, that is that in intestine we have symbiotic bacteria which occur naturally in the guts. So toward that useful symbiotic bacteria, if intestinal immune systems are inappropriate and continuously activating, then it can lead to condition inflammatory bowel disease, which is mainly going to involve colon and small intestine. So this is the topic where mainly we have to discuss about the two types of IBD. One is called Crohn's disease, another is called as ulcerative colitis. So Crohn's disease can take place anywhere from anus to mouth, any part of the gastrointestinal tract, but ulcerative colitis is going to confine to a large intestine, especially the colon parts. So let us discuss about the Crohn's and ulcerative colitis individually, then we'll see the difference between these two. So Crohn's disease is defined as an idiopathic. Idiopathic means the reason is unknown. Chronic ulcer, constrictive inflammatory bowel disorder, and it is characterized by the presence of non-caseating granulomas. Non-caseating granulomas means non-caseous. Actually, caseous is a type of necrosis. So non-caseous means it is non-necrotic. There is no necrosis, that is cell death. And granuloma is a mass of granulous tissue, which is produced in response to the infection or inflammation or the presence of foreign substance. So that mass of granulation tissues is called as granuloma. So non-caseating granulomas. Finally, delimited and typically transmucal involvement of bowel by an inflammatory process with mucosal damage. So delimited means having fixed boundaries or limits. Transmucal means throughout the length of mucosal membrane. Then fissuring along with the formation of fistula. So fissure means a split or a crack to form a long narrow opening, that is the fissuring. So and fistula is abnormal passage between a hollow or a tubular organ and the body's surface. So that abnormal passage is called as fistula. Crohn's disease most commonly affects the terminal ileum, means last part of the ileum, duodenum, jejunum, and ileum, which is a part of small intestine, and colon. It may also involve any segment of the gastrointestinal tract from mouth to anus. What is the etiology and risk factors involved in the Crohn's disease? Is young people in the age group of around 15 to 35 years are more prone to Crohn's disease, although this disease may also occur in elder or young population. Second is environment. This disease is more prominent in the countries like North America and Europe. The exact environmental factors, including their lifestyle like food habit, possible toxic exposure, example pollutants, are responsible for spreading the disease. Now, third is hereditary. Crohn's disease is known to run in family. Around 20% of the patient with Crohn's disease are known to have a family history of some form of inflammatory bowel disease. There are 20% chances of hereditary, that it travel from family in generation to generation. Smoking habit, people who are at higher risk of developing Crohn's disease than the non-smokers. So smoking may leads to Crohn's disease. What are the symptoms of Crohn's disease? It may be chronic diarrhea, abdominal cramping, abdominal pain, fever, loss of appetite, blood in the stool, foul smelling stools, weight loss, and increased white blood cell count. There is increased WBC because of the activation of immune system. So immune system cell is WBC, so their counts increase in Crohn's disease. Then the second types of inflammatory bowel disease is ulcerative colitis. It is an inflammatory bowel disease that cause inflammation or sores, also called as ulcer in the lining of rectum and colon in retrograde fashion. Retrograde fashion means especially this start from the rectum and it spreads in the reverse direction, that is retrograde fashion. It is considered as autoimmune disorder. So it is the condition where your immune system is going to attack your gut or intestines and cause ulcerative colitis. What is the features of ulcerative colitis? Ulcero-inflammatory disease is limited to colon. So this ulcerative colitis generally derived from the word colon. So it is going to mainly confine into colon. It extends in the mucosa and submucosal regions. So their severity can extend up to the mucosa and below the mucosal layer, that is called as submucosal regions. It starts from the rectum and extends upwards. The entire colon could also be affected in ulcerative colitis. Then etiology. The exact etiology of ulcerative colitis is unknown, but few assumptions are there, which are as follows. Abnormal activity of the immune system in intestines, as the body's immune systems react abnormally to the bacteria in the digestive tract. So when the immune system of your body is going to react abnormally to your own bacteria in the digestive tract, then it can lead to ulcerative colitis. Some then genetic factors. Then third is food allergy, especially the allergy to the milk can lead to ulcerative colitis. Smoking, ulcerative colitis is less prevalent in smokers, as nicotine in the cigarette smoke act as anti-inflammatory. So this is especially one type of disease where we can say that those who are the smokers, they don't get this ulcerative colitis, because the cigarette nicotine act as anti-inflammatory. So the nicotine present in the cigarette act as anti-inflammatory agents and don't cause ulcerative colitis. Next, antibiotic therapy leads to acute colitis because antibiotic is going to disturb the normal balance of intestinal bacteria. So that's why antibiotic is not always advisable because it can uh, cause the disturbance of intestinal bacteria. Then it may be due to diet and psychological factors like patients who are abnormally sensitive. Then infection due to bacteria like mycobacteria or dysentery, bacilli or virus, fungi and protozoa. So infection because of the bacteria, virus, fungi and protozoa can also lead to ulcerative colitis. What is the symptoms of ulcerative colitis? It is a bloody diarrhea, means there will be blood in the liquid stools, then abdominal pain and swelling, anorexia, that is lack of appetite, then intermittent rectal bleeding, there will be bleeding from the rectum, sensation of incomplete bowel emptying, means you will feel that the bowel is not empty, presence of visible blood and mucus in the stool, stools are normal or hard if the disease occurs in the rectum, and rectum and sigmoid colon, and looser stools are looser if the disease extends further. Then constipation problem, tenderness over the colon, peritonitis. So peritonitis is nothing but the inflammation of peritoneum. Then symptoms are observed outside the colon. So these are all the symptoms associated with the colon. But if you are having ulcerative colitis, then it can lead to symptoms which may be outside the colons, like mouth ulcer involving the tongue, lips, palate and pharynx, deep vein thrombosis. Thrombosis is nothing but intravascular blood clotting, and pulmonary embolism, formation of embolus in lungs, hemolytic anemia and growth failure in children, dry tongue, tachycardia, that is increased heartbeat. Uveitis is nothing but the inflammation of entire uveal tract. And what is uvea? It is the pigment layer of the eye lying just below the sclera and cornea. So, and it mainly involves the structure like iris, choroids and ciliary body. So if that uvea tract is going to get inflamed, then it is called as uveitis. Ankylosing means total loss of joint movement. Spondylitis means the inflammation of vertebra, skin lesions, and then inflammation of the bile duct. So these are the symptoms of ulcerative colitis, which is outside the colon. So main this Crohn's disease and ulcerative colitis, we can remember in the form of the points differentiating between ulcerative colitis and Crohn's disease. Like previous chapter in peptic ulcer, we have discussed about the duodenal and gastric ulcer. So a good thing is that to remember the points differentiating between the ulcerative colitis and Crohn's disease. So gender in ulcerative colitis, it can happen in both male and female, but in Crohn's disease the chances of female getting is more. Incidence 2 to 19 per lakhs per year, where it is 2.1 to 20 per lakhs per year, that is the incidence of occurring this IBD. Smoking in ulcerative colitis, smoking is supposed to be a protective factor, whereas in Crohn's disease it is going to increase the IBD, that is going to aggravate. Onset, if you see, ulcerative colitis generally take place between the age 15 to 40 years. Even Crohn's, it takes place between the age 15 to 40 years. Location wise, if you see, ulcerative colitis generally take place in distal colon. So distal means the area which is situated away from the center of the body, or the point of attachment. So away from the center or point of attachment is called as distal. So ulcerative colitis generally take place in distal colon, whereas Crohn's disease take place in distal ileum and cecum. So that is the important points. Ulcerative colitis is the disease of colon, whereas Crohn's disease can actually take place from any mouth to anus, especially in the ileum and cecum. Ileum is the last part of small intestine, like duodenum, jejunum, and ileum, and cecum is the starting point of large intestine. Then pathology, ulcerative colitis is actually continuous inflammatory lesions from distal colon to proximal colon. Proximal means situated near to the center of the body, or the point near the point of attachments. Here in Crohn's disease, there is a discontinuous patchy gut inflammation with skip lesion. So here in ulcerative colitis, the inflammation is going to take place continuously, there is no break, whereas in Crohn's disease it happens in patchwise. The inflammation is not continuous, that's why it is also called as skip lesion. Histology, if you see ulcerative colitis, it is actually the inflammation which take place on the surface, that is called as superficial inflammation, whereas Crohn's disease, it's a transmural inflammation. Transmural means throughout all the layers of the colon, means the total thickness of the colon, all the thickness is involved, that is called as transmural inflammation. Complication, if you see ulcerative colitis, there is a severe bleeding, rupture of bowel, and colon cancer. Whereas Crohn's disease is stenosis, that is the hardening of gut, then abscess formation, then fistula, then colon cancer. So these are the complications of Crohn's disease. So along with these differences, you can write some more differences between the Crohn's and ulcerative colitis. Crohn's inflammation tends to occur in patches. Here in ulcerative colitis, inflammation is more likely to be uniform or continuous, that we have discussed. Crohn's disease can affect any part of the GIT tract from the anus to esophagus. Ulcerative colitis localized to the rectum and the large bowel. Crohn's blood and mucus in the stools not as common, whereas in ulcerative colitis, blood and mucus in the stools are more common. In Crohn's disease can also cause nausea and vomiting, whereas in ulcerative colitis, nausea and vomiting not usually seen. Crohn's, there is abdominal pain, may be more severe or continuous, whereas in ulcerative colitis, pain is more likely to be intermittent and experienced with the bowel movements only. It's not continuous. In Crohn's disease, there is inflammation present in mucus and muscle tissues, and whereas in ulcerative colitis, it is inflammation is generally confined to the surface, that is confined to mucosa. In Crohn's disease, granulomas, that is specially cell formations developed by the immune system to isolate threats to the body, usually present, whereas in ulcerative colitis not as likely to cause granulomas. In Crohn's, more likely to cause fistula, small tunnels, fissures, that is tears, or stricture, that is narrowing in the bowel, whereas fistula, fissure and strictures are less common in ulcerative colitis. In Crohn's, more common seen in smokers, and ulcerative colitis more commonly associated with So ulcerative colitis is more commonly found in with those who are not smoking or who was previously smoking. Crohn's disease is treated with steroids, immunosuppressant the medicine which suppress the immune system, and biologics. Biologics are the product that we obtain from the living organism. But 5-ASA not usually is effective. What is 5-ASA? It is a penta-aminosalicylates. Is not usually effective for the Crohn's disease. Whereas ulcerative colitis, it is treated with the steroids, penta-aminosalicylate, immunosuppressant medication, and biologics. Surgery may not eliminate the disease, Crohn's disease, whereas surgery to the colon resolves this ulcerative colitis. So that is the difference between the Crohn's and ulcerative colitis. So after this differentiating point, you can see here that Crohn's disease, the age of onset is generally between 15 to 35 years and 50 to 70 years. Symptoms depend on the location of the disease and include abdominal pain, diarrhea, weight loss, and fatigue. Bloody stool variable. You can see here the inflammation is not continuous, it is taking place in patchy inflammation throughout the small and large intestine. Whereas in ulcerative colitis, you can see that the inflammation is continuous and uniform in especially the large intestine. So that is the main difference between Crohn's disease and ulcerative colitis. Now the next is pathogenesis of inflammatory bowel disease. So you can draw this flow chart, or you can draw this flow chart. So this is more informative flow chart where the inflammatory bowel disease is going to take place in some phase, that is phase 1, phase 2, phase 3 and phase 4. Phase 1 is also called as pre-disease stage, and it involves genetic factors and environmental factors. Genetic factors like antimicrobial peptides, autophagy, handling of bacteria, chemokines and cytokines. Whereas environmental factors like microorganism, diet, infection, sprays, non-steroidal anti-inflammatory drugs, appendectomy, that is the removal of appendix, smoking and antibiotics. So these are the environmental factors and these are the genetic factor which can initiate the triggers, and that can lead to impaired barrier function, and microbial product can come inside the mucus cell, and there is a translocation of microbial product, and because of this what happened, the immune cell is going to get activate, especially effector T cell and macrophage gets activated. Production of pro-inflammatory mediators which is done by the effector T cell, whereas there is a failure of regulatory mechanism of this mucus layer of the intestine, that is the regulatory T cells is going to get fail. The macrophage and effector T cell is going to get activates, and which leads to the chronic inflammation, and finally it leads to fibrosis, stenosis, abscess, fistula, cancer and extraintestinal manifestation. So this all is going to happen. It is in phase 1, phase 2 there is immune cell activation, in phase 3 that is chronicity or resolution, where the immune cell is going to cause inflammation. Then phase 4 there is a tissue destruction and complication. So this is the main mechanism behind the inflammatory bowel disease. It means it is a condition where there is going to cause the inflammation of small intestine or large intestine because of the activation of immune system. That is, inappropriate activation of immune system can leads to inflammatory bowel disease. This is the pathogenesis of Crohn's disease, where antigenic stimulation, that is microbial or dietary antigens, is going to cause intestinal mucosa, which is having gut immune system, leads to physiological inflammation. And if it is in the normal host, then inflammation will be limited and there will be healing with no tissue injury. But when the host is susceptible, and along with genetic predisposition and environmental factors, then it leads to uncontrolled inflammation and leads to extensive tissue injury and finally leads to Crohn's disease. So this is a separate flow charts for explaining Crohn's disease. So this is the main pathogenesis of inflammatory bowel disease happening in phase 1, phase 2, phase 3 and phase 4. In phase 1, genetic and environmental factors acts on the small intestine or large intestine, and which leads to acute intestinal inflammation, especially immune cell activation. In phase 3, there is a chronicity or resolution, where the macrophage and effector cell is going to cause chronic inflammation. And in phase 4, there is a tissue destruction that finally leads to inflammatory bowel disease, that is Crohn's disease or ulcerative colitis. If you want, you can also draw these flow charts for pathogenesis of inflammatory bowel disease, where eliciting and etiological factors like bacterial antigens, environmental factors and chemical agents. So this all leads to inflammation and oxidative stress, and this leads to it can along with genetic factors predisposition, this can leads to oxidative tissue injury, perpetuations of inflammatory response, which can lead to development of inflammatory bowel disease. So any of the flow charts you can draw for pathogenesis of inflammatory bowel disease. So inflammatory bowel disease, mainly you have to write the definition and remember the two types, that is Crohn's disease and ulcerative colitis, and most of the points you can remember in the form of the differences in this table and some points from this table. And finally the pathogenesis of inflammatory bowel disease. So just like peptic ulcer, we have discussed about the difference between the duodenal ulcer and duodenal gastric ulcer. So here also most of the points you can remember in the form of differences, and you can explain separately Crohn's disease characteristic, then etiology, then symptoms, then ulcerative colitis characteristic, then etiology, then symptoms. So that's all about inflammatory bowel disease. Thank you.